what our system does is it learns about your lifestyle, and then it provides that information in formats that can be used by insulin delivery systems or, more broadly, drug delivery systems.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster on the floor of the American Diabetes Association annual scientific sessions with my friend here, Sam Royston, CEO and co-founder of Replica Health. Sam, great to see you.
Great to see you too, Logan.
I'm excited to hear an update on what you're building at Replica Health. You're part of the T1D Moonshot, right, at Startup Health. What stage is your company in, and what are you working on?
So we're early stage tech startup. We're building AI for insulin delivery systems. More broadly, we're a contextual intelligence platform. So what our system does is it learns about your lifestyle, learns about where you are, and then it provides that information in formats that can be used by insulin delivery systems or, more broadly, drug delivery systems.
Okay, sounds like a system that we need, that folks need. What's the response been here at the ADA?
It's been good. I came last year and it was my first ADA. I didn't know a lot of people. I was sort of jumping into the deep end. And this year feels a little different. Like, we have some traction. We have contacts at different companies, and we're working those. So.
What kind of traction have you seen?
So, I think one of the bigger things that's happened since last time is we've gotten a deal to work on a study that establishes non-inferiority of one of the components of our system with an existing automated insulin delivery system. Okay. So what we're going to be doing is comparing side by side how the AID system works versus that AID system plus our little component. Okay.
Obviously, everyone's talking about GLP-1s here, and everyone else is talking about AI here. It's like the two big buzz terms. Everyone's applying AI. So you come into the market. Does that mean everyone's really excited about what you're doing, or does that make people skeptical because there's so much happening?
It could go either way, okay. Honestly. But yeah, there's going to be one of those two responses. Yeah. I think it's healthy to be skeptical of buzzwords and stuff. I spent a lot of my life being one of those people who is skeptical of this stuff. Like I went to school for machine learning. I studied blood glucose prediction at NYU, and I've just been like a machine learning engineer or leading engineering teams ever since school. And I was often in that position where I'm like, hey,
is this real?
These are just buzzwords. But I'll say that like cynicism is a way to be right most of the time, but it's the easy way to be right most of the time. And you need to really take a risk on things that may likely not work out, but if they do work out, it's the most likely path to making something.
That sounds like the mindset of a founder. Were you were you entrepreneurial before, or is this kind of like a new concept for you?
I worked for large companies, tech startups and stuff. Before this, I co-founded a anomaly detection software platform. But I was more in like a CTO role there, and I wasn't responsible for fundraising and all the other stuff that a CEO has to do. So this is a new experience in that respect. I'm sort of I think it's in my blood a little bit.
I want to get really practical about how Replica Health can help a patient in the future. Let's just push it out a few years. One of my best friends, his daughter, 10 years old, has T1D. Every day he's thinking about how can I improve life for my daughter. So I don't know, paint me a picture of what that's like with Replica Health in the mix.
So we could take two. I could explain to you like a component that we're going to be testing, which I want to do. But I also want to take time to look at an analogy with computer vision that I think is instructive here. So anybody who's been living in our society for the past 3 years has recognized this crazy shift in AI that's happened with language systems. And before that, it was a little bit with vision systems, right? Like you can get a sentence describing any image. So back 10, 15 years ago, this was not the case. And we had a lot of systems that could sort of do stuff, but the data sets weren't big enough, the compute wasn't big enough. And what I really am looking at with Replica is what catalyzed that transition, and then how can we make that happen within the space of metabolic health, right? So with CGM data. And what you really need is a open data set that's of a certain size, right? Orders of magnitude larger than the open data sets that we currently have with CGM data. So that's something that we're focused on and will improve blood glucose prediction systems and therefore insulin delivery systems, right? So that's that's maybe more years down the line than you asked about. It's like 7-10 years. But if we're able to create a competitive environment where different researchers are training different models and competing against one another to get the best results, then you'll start to finally see things like transformers applied to blood glucose data. And transformers, like the architecture that you would.
Okay, so if I'm hearing you correctly, so my question was more about like the end user and how their experience is going to be different. And you have a unique experience in machine learning, and so you really went to improving the foundational data on which all solutions.
That's one of our like avenues that we're pursuing, but we recognize that there's going to be stepstones along the way, and you need to make incremental improvements to make any improvements.
But that's just very interesting to me, and it speaks to who you are and what's special about your team, that you're saying let's improve the foundational, the building blocks, the data that
work on a lot of different fronts to make progress, I think. But I'll go back to maybe answering your question more directly. So what we have right now, one of the things we have is a system that will, given your context, predict. I can show you on my watch here, but it'll predict like the most likely meal given your past. So it thinks egg sandwich is the most likely meal. Coincidentally, I just ate it. If you look in that paper bag right there, it's an egg sandwich, right? And I didn't tell it anything. It just knows that based on maybe my activity over the past couple days, or I eat egg sandwiches in the morning a lot, so it might be a time-based thing. But in any case, if I select one of these events, this is my app, yeah.
Okay,
so yeah, so if I select one of those events, it'll give you a curve that's showing you. So I selected banh mi there. Okay. It shows you the carbohydrate release curve that's estimated for that meal, right? And what we can do with that is you can then send it to an insulin delivery system, and then that it can use that. Exactly. So this is actually integrated with the open source loop system now, and that's what our study is going to be around. It's going to be with Tidepool. But
how competitive is that landscape right now, applying AI to closed loop systems?
Well, I think it's competitive. There's a lot of people. Obviously, it's like people recognize that it's a good idea, but you need to provide these components in like sort of like modular shapes that can just fit onto existing artificial pancreas systems. It's a heavy lift to just come out of left field with a new artificial pancreas system and AID system and be like, hey, this is the new, like let's use this. So instead, I think that our approach is right, where we create these smaller components that will iteratively update the existing systems.
What's it been like being a part of the T1D Moonshot and being a part of a community of folks who are also passionate about this space?
Hey, it's good. It's good to be around. It's a small space, type 1 diabetes. We certainly hope to expand outside of that, right? Contextual intelligence is useful everywhere, but just working with these people and having people who automatically understand the struggles that you face is really nice. And there's some good I mean, you got industry leaders coming in on a pretty regular basis. So I think it's actually a good program for us.
Sam, great to see you. Excited that you're here for the second time. I hope that the meetings go well today and that you keep growing over the next couple of years. We'll keep watching.
All right.
Thank
you very much, Logan.
All right, thanks, Sam.